corner. I think we're live.
Is this thing on? Is this thing on? Are we live on Oh Gross?
We are.
Well, we'll wait for everybody to join us because I know that all these people are joining in real quick to see what's going on with Oh Gross. But
because they see Dr. Steve here.
So we're going to call this this is the viral truth, but it's a PSA version where we're going live to ask our favorite infectious disease doctor, but your favorite doctor in general,
Of course.
of all things, some questions that I think everybody has been wondering when it comes to some of these myths and things that people tell us when it comes to our health or disease or how things are passed around. So are you ready, Dr. Steve, first of all?
I guess I'd better be. Let's do it.
Have you ever gone live on social before, Dr. Steve?
Yes, but it's been a while. So
It's been a while. Okay.
got a haircut
Awesome.
yesterday and everything. So.
Oh, you did. You look great. You look fabulous. Okay. All right. I'm gonna start with one that is not actually about infectious disease, if that's okay. I'm just curious about it, okay? Because I remembered this last night. Should you put butter on a burn?
Oh, that's a good one.
Well, done wrong, it could become an infectious disease problem. So there are no data that is helpful. In fact, the only thing really that's ever been shown to help a burn is immediately after the burn, just do cool water. Because after all, there's still thermal injury going on, so the tissue beneath the skin directly has been heated up. So you want to cool it down to stop that process. So you put cool water and run it on there sometimes for 5 minutes and let the tissue below cool down. That'll prevent blistering, sometimes prevent some damage that might have continued to cook, for lack of a better word, beneath the surface. But no information that putting butter or honey, despite its purported antibacterial activities, has ever really
So where
helped.
did the butter come from then? I mean, you said cook, but I'm just curious, like, where did the butter come from, that whole myth?
Probably from a cook. Yeah, I'm not. I'm not actually
Maybe
sure
because
where
it's
it came
cold?
from, other than it might make it feel a bit better, I suppose. I'm not sure, putting some occlusive thing on there. But in general, what you really just need to do is to cool down the tissue. So anything you smear on there, whether it be butter, I think some people try honey and other things like that, and though sometimes that may feel better, no real data that it's helping you at all.
And could butter have bacteria in it that is not helpful if you have a
Sure.
burn?
No, absolutely. Any biological substance like that could potentially transport some bacteria on there. So something like an antibacterial ointment, mupirocin, or those kind of things is probably in a small dose over the top of a burn can be helpful, certainly.
And couldn't you be clogging it from draining too, so that it can't actually
Butter
seep
clog.
And yeah. Ugh.
Yeah, a grease-based product could be sort of occlusive, and burns are variable, of course. Sometimes they'll blister up, but if they open up all the way, there's not a lot of drainage unless you have a pretty bad burn. But yeah, occlusive stuff in general may not be the best. Again, particularly if it's a biological kind of substance.
So leave the butter in the fridge. No,
Exactly. Save it
So that
for
would be a
your
viral
cooking.
untruth.
Exactly.
Right?
Viral
Exactly.
untruth.
Exactly.
Jenny, are you up? Do you have a question for Dr. Steve?
I do. Okay, and this is funny because I do this a lot. Can
Uh-oh.
cracking your knuckles cause
Yes.
arthritis?
Yeah, so I do it sometimes too, and thankfully for you and me, that there's no evidence that actually causes arthritis. There's a little negative pressure air gap in there that pops when you make when you crack your knuckles like that, and it turns out that that's okay. That's not harmful. They've actually done studies and compared that and looked, and it doesn't predispose to arthritis. Your genetics, how much load you put on your joints chronically. There are other factors that can have it. So probably the best thing you can do to avoid osteoarthritis is to choose your grandparents carefully, because that's about.
But can I still tell my children it will cause arthritis?
Your personal life is your own business. I'm perfectly happy.
There you go.
All right. This is a weird one. So it's funny because you're going to probably have to explain first. Can we actually, I'm going to have you explain to everybody who's listening what Bell's palsy is, because some people don't know. Can you first explain what that is?
Sure. Bell's palsy is a sudden, often immediate paralysis of one side of the face, so-called seventh cranial nerve is what controls that, palsy or paralysis. And you wake up and one side of your face droops and so forth. Bell's palsy is interesting, though, because by definition, it's one that is idiopathic. We don't know why it's happening. Lyme disease will do it. Some of the, like fever blister virus, herpes simplex can be behind some of it, but that wouldn't be Bell's palsy because that's not idiopathic if you know the etiology. So it's one that's unexplained. People have sudden paralysis of that side of the face. Frequently it goes away on its own over time, but some people can be left with a little weakness over time as well afterward.
So my question is, I remember hearing as a child that sleeping with the window open, especially if it was a cooler night, could cause Bell's palsy. Is that true?
So I guess, of course, by definition, then it would be cold-induced paralysis, so it wouldn't be Bell's palsy anymore. But there's no real clear data that that's the case. Interestingly, there could be a shred of truth behind that, because they've done some studies looking at different climates and temperatures and wind chill areas, and so it could be that there is some association with a bit colder climate, but that's really unclear, and there's no recommendation or any clear data in humans that really does cause it.
So would that be a viral possible truth?
Yeah, conceivable. Probably not, but too early to completely rule out. Yeah. Maybe a shred of truth in that.
Shred of truth.
There we go. Okay, I've got one. My husband will be excited about this one because he does like a good whiskey. But does whiskey kill germs?
All right. So good question. It turns out that the ethanol in drinks are not a high enough concentration. That's kind of at the highest 40 to 50% by volume alcohol, whereas the things we use in kind of biological situations and in clinical things to get rid of germs is more like 70 to 90% alcohol. So, and they've even done some studies where they immerse things in things like whiskey. It just doesn't do much to toothbrushes or other kinds of things. It just takes a higher concentration of alcohol to do that.
So the fact I dip my toothbrush in whiskey every morning is not helping me. I'm kidding.
May taste better, but probably not going to help decontaminate your mouth at all.
But so hot toddies, the whole idea of a hot toddy when you're sick is just because you want a hot toddy.
I suspect so. Yeah,
it's got
may open up the nasal passages a little bit, so it's
I guess the lemon.
Symptomatic temporary relief, I suppose, just from the inhalants. But yeah, not a big antibacterial, antiviral concentration there.
It'll make you feel a little better.
Make you worry less about the nasal congestion.
Well, maybe the lemon would be antibacterial, the lemon juice, right? More than the whiskey?
Probably not much, really. I mean, it doesn't do a lot much, but
just forget about it.
Forget about the whole thing. All right. Does rubbing alcohol break a fever?
So that's a good question. People do that a lot, and it turns out that the real recommendation is not to use alcohol for a couple of reasons. Number one, just tepid water sponged on somebody, let's assume it's as a kid with a high fever, 103 fever, just sponged on them, it will evaporate over a little longer period of time, and it does just as well to reduce fevers as doing rubbing alcohol on there. It'll evaporate faster, may make them feel chilled, it's more uncomfortable, and worse than that, on occasions you can absorb with kids some alcohol through the skin. So then you have a kid with fever and intoxication, and that doesn't help you at all.
No, we don't want that.
In general, it's recommended just to use tepid water and let that evaporate slowly.
Where do you think that came from? That because is it because alcohol makes you feel like it's a cooler surface when you?
Yeah, I mean it does evaporate quickly, and on the very superficial of the skin, it makes it feel cold, and it does evaporate. It does make that cooler, but in terms of the big picture of cooling down the whole body, a little more, just generalized sponging with tepid water works just as well, and doesn't have all those other baggages that can cause problems.
I love that you brought that up, though, because so many people don't realize that alcohol can absorb through the pores of your skin.
Yeah, and the volume put on a little kid or something, it can be significant,
right.
And so
it can be significant.
And if there was some huge added benefit, but there's not, and so it's probably not worth the excess, even small risks of doing it.
Exactly. I love that we talked about this. Okay, I've got one, Kara.
Mm-hmm.
Now, I'm sure that your grandma and my grandma have said this. Should you really starve a fever and feed a cold?
So that's interesting because weirdly, there's probably some accidental truth to this because you're sort of getting at it backwards. It is true that in a bad febrile bacterial infection, you will feel terrible and not want to eat anything. And I think our evolutionary past is you're supposed to stay in the tent and not hunt buffalo that day. So you feel terrible. Right. You don't eat as much. And in bacterial infections, there are some kind of rudimentary pieces of information that's saying that not taking a lot more glucose in can actually help your immunologic response to bacteria, whereas that's not true of viruses. So theoretically, having a little bit more of that input of calories and stuff could be helpful in viral infections. So oddly, it's an observation of what happens that probably observes what the body does naturally to help how it does things differently as it fights viruses or bacteria, and we fight them differently. So there's a shred of truth in it, but nowhere is there any kind of recommendation to say, I think this is a bacterial infection, so I'm going to starve my kid for another day, or I'm going to stuff potatoes in them if they have a viral infection. You know the difference.
Well, also,
the body will know the difference between a bacterial and a viral infection before we do. And so it does those things naturally. So it's probably more an observation than something that you should do to help the body along. The body is amazing.
Well, maybe historically, though. But maybe what you're saying, too, is historically, going way back when people were just trying to figure out how to, what different bacterial versus viral infection was, they could have documented and noticed, like you said, that when they didn't eat as much, that the body bounced back quicker when it was A or versus B, and that just sort of started this, saying from who knows.
Yeah, right? Even now it's a very difficult thing to quantify or to study.
Right.
But the body's an amazing thing. For example, people get hung up on knocking fevers down. I mean, infectious disease guys go, look, if they have 103 fever and they're feeling fine, leave it alone. Because we don't like fever, but bacteria hate fever even more than we do. And so it's an adaptive way of helping us fight stuff. So the body seldom makes mistakes. The body never goes to 108 unless the thermostat, like a stroke or something, knocks it off. So the body seldom damages itself in long-standing reactions that it's used to doing and adapted to doing.
And it's actually fighting off what it's supposed to, which a lot of people forget, I think. I mean, okay, here's the thing, because I swear this happened to me, and you have to tell me if it's true or not. Can you get the flu from the flu shot? Or
that's a good one.
So the short and most of the long answer is no. The flu shot, let me do the exception first. There are live attenuated flu mist, the nasal mist, and that it does have some attenuated flu vaccine. That is to say, it has actual flu in it that is adapted to cooler temperatures, can't cause you a problem, it's weakened significantly. And so it can cause a little mini micro flu case just in your nose, which will excite the immune system and kind of ward it off everywhere. So it's not recommended in the elderly, in people with immunosuppression, because we don't want to tempt that virus, even though really knocked back, to be able to do more than it can. So that's the exception to what I'm talking about. But even so, it does not make you clinically sick or have the flu. So almost all flu shots out there are just chopped up viral particles that we put in your arm. So it's not anything of any high tech. They take proteins of the flu that your immune system would see, they chop them up, they're non-functional, they're little pieces. And remember that our immune systems don't identify the flu or the common cold or anything. They identify 8 amino acid pieces of protein, so small that we can chop them up into very fine segments.
But then why do we feel like, I mean, some of us get sick after the flu shot, or get sick after, why is that then?
There are two things behind that. Yes, any shot can sometimes excite the immune system and make you feel kind of bad. We see this in the shingles vaccine and even the COVID vaccine, something more even than the flu vaccine. The other one, and I think where a lot of that came on, this old rumor, is that people get flu shots during flu season. And the reason they get sick out of the flu shot is that they get the flu before the flu shot would have worked a couple of weeks later. So the real reason that the flu shot caused the flu in them is that they didn't get it 2 weeks before and would have warded it off. So if you take a flu shot and then are exposed to the flu 3 days later, you haven't had time for the flu shot to protect you. So that's where I think a lot of the rumors came that they got the flu right after they got their flu shot. And that's true, but only because they got it too late.
That makes sense.
That totally makes sense. And this one wasn't on our list, but I'm going to throw it out there real quick because I know Jenny's got to go and you got to go because you got to go see patients and stuff. You busted into your day. But okay, the chicken pox. Can you only get it once? I know that you can get shingles later, but can you only get physically chicken pox once?
So that is true by the definition of the term. So the virus that causes chicken pox and shingles, by the way, is called the varicella zoster virus. Varicella is the scientific word for chickenpox, and zoster is the scientific word for shingles. So varicella or chickenpox is by definition the first time you get the original infection. Every version of it later, which is almost always shingles, is called zoster. Now, if you're an immunosuppressed person, you're a bone marrow transplant or organ transplant or heavy steroids, you may have zoster that will spread out all over you, and for all practical purposes looks like and behaves like chickenpox. But it's not called chickenpox because it's not the first time you got it. It's called disseminated zoster. And disseminated zoster can be contagious like chickenpox. It can make you really sick like chickenpox, but it just is a version of what kind of person is immunosuppressed and might have that happen. But by definition of the term itself, chickenpox is the first time you get it, and so you can only get that once.
And someone is sawing a tree.
They are.
This is live, really live, folks.
This is
Click here
live.
to follow on YouTube now. But this is live. We're going live with these things. So when somebody says, because I remember when I was little, they said if you only had one pock when you were little, you might get chickenpox again. That's not necessarily true. It's not chickenpox if you get it again, even if you only had one pock.
Yeah, that is true, and you don't usually get. I mean, the people who are very immunosuppressed can conceivably get again disseminated zoster. But if you had the infection of chickenpox, that's it. It is by definition the first time you get it.
That's only the first time, folks. You heard it right here on Vial of Truth with Dr. Steve. Okay, now
That's
listen.
amazing.
Come follow us on Spotify, YouTube, all the channel, anywhere you get your podcast, Apple Podcasts, and of course on all social channels. We are at It's Oh Gross, and we will be doing more of these in the future. And we hope that this PSA with Dr. Steve let you know what was the viral truth and not.
Yes. Thank you, Dr. Steve. This was awesome.
Yeah, and let us know if you have any questions for Dr. Steve for the next time.
Yes.
Thanks, guys.
Thank you.
Thanks. Bye.
We did it live.
We did it live.